Hello Visionaries, and welcome to today's video. It is so good to have you join us. On this channel, we are building the gaps that exist in our many health systems. We aim to empower, strengthen, and provide resources to health administrators so that in their communities, they can expand access to care, reduce health disparities, and create healthier and more resilient communities. We know this is not easy, and that is our reason for supporting you on this journey. If you're a health administrator looking to boost your salary within the next 6 months, you're in the right place. There is a lot of work that goes into leading health teams. Getting a salary that is commensurate with your value is something we all strive for in our work. In this 3-part series, I'm sharing powerful strategies to make that goal a reality. Today, we'll focus on the essential first step, building your value proposition. We will review 3 major points: documenting achievements, identifying key metrics, and positioning yourself as an essential asset. This is all about proving why you deserve that raise. Let's dive in. Section 1, documenting your achievements. This is crucial because if you don't make your contributions visible, they could go unnoticed. Let's break this down further with actionable steps and examples. Step 1, track your projects. To effectively track your projects, start by compiling a comprehensive list of all significant work you've done over the past year or even the past few years. Go beyond the day-to-day tasks and focus on projects that brought change or added value. For example, let's say you led an initiative to streamline patient check-in procedures. Before you started, check-in times might have been averaging 15 minutes per patient. After implementing your strategy, perhaps introducing digital check-in kiosks or a simplified paper process, you brought that average down to 8 minutes. This improvement not only reduced patient wait times, but likely improved overall satisfaction and increased clinic throughput. When tracking your projects, use a simple table with columns for project name, e.g., patient check-in, improvement initiative, objective. Reduce check-in time for better patient flow. Results: check-in times reduced by 7 minutes per patient. Impact: improved patient satisfaction scores and increased efficiency. Step 2, quantify your results. Numbers can make your achievements very hard to disprove. Quantifying results means taking your project outcomes and translating them into hard data. Remember, executives and decision makers often respond well to concrete numbers. Let's use another example. Suppose you were responsible for optimizing the staff scheduling system, leading to a 10% reduction in overtime hours. This not only saved the organization a significant amount of money, say $30,000 annually, but also improved staff morale by reducing burnout. When presenting this, you could frame it like this: through a new scheduling algorithm and staff input, I reduced overtime by 10%, resulting in an annual cost saving of $30,000 and increased team satisfaction. It's also beneficial to back this up with visual aids like graphs or charts. A simple before and after bar chart showing overtime expenses over the past year can visually reinforce your narrative. Step 3, create a portfolio. This portfolio is your personal greatest hits collection. It doesn't have to be complicated. Start with a digital document or a binder divided into clear sections. Include project descriptions, a summary of what you did and why it mattered before and after data, graphs that showcase key changes like reduced wait times, increased vaccination rates, or cost savings, testimonials, and emails. If a colleague or supervisor has ever complimented your work or sent a thank you email acknowledging your contribution, include a snippet or the entire email, with permission, of course. Photos or screenshots. Include images of dashboards or data reports you managed or designed. For example, if you launched a new community outreach program that brought in 500 more participants for health workshops, include photos from the events, a data summary, and maybe even a quote from a community leader who acknowledged the program's impact. This combination of data and qualitative feedback makes your case even more compelling. Section 2, identifying key metrics that align with your organization's goals to amplify your value proposition. Now that you've documented your achievements, it's time to take a closer look at the metrics that best demonstrate your value. Metrics are the language of results, and when used effectively, they help paint a clear picture of your impact as a health administrator. Let's dive into how to identify and use the right metrics. Step 1. Align with organizational goals. One of the most important aspects of choosing metrics is ensuring they align with your organization's goals. Every healthcare organization has targets, whether they are financial, operational, or quality related. To maximize your impact, tie your achievements to these targets. For example, let's say your organization's goal is to reduce hospital readmission rates, which can improve patient outcomes and reduce costs. If you led an initiative that introduced a post-discharge follow-up call system that reduced readmission rates from 15% to 10% within 6 months, that's a metric worth showcasing. Here's how you might present it. Metric reduction in hospital readmission rates. Achievement. Implemented a follow-up call protocol. Outcome. Readmission rates dropped from 15% to 10%, saving approximately $100,000 in potential penalties from insurers or government programs. Step 2. Highlight key operational metrics. Operational efficiency metrics can be powerful indicators of your administrative skills. Health administrators often manage systems that impact workflow, patient throughput, and overall resource management. Take, for example, improving patient scheduling to maximize appointment slots and reduce no-show rates. If you manage to reduce no-shows from 20% to 12% by introducing an automated reminder system, you're not just making life easier for the scheduling team. You're increasing revenue and enhancing patient access to care. Here, the metric is no-show rate reduction. This improvement can be quantified in terms of increased completed appointments and the additional revenue those appointments bring in. Suppose each appointment is valued at $100 and you manage to secure 50 more completed appointments per month. That's an added $5,000 per month, or $60,000 annually. Step 3. Include patient-centered metrics. It's equally important to focus on patient-centered metrics, as they align directly with the mission of most healthcare organizations, improving patient care. Metrics like patient satisfaction scores, adherence rates, and treatment plan compliance are compelling indicators of success. Consider this example. You spearheaded an educational program that improved medication adherence in patients with chronic illnesses. If adherence rates jumped from 65% to 85% after implementing your program, this is a metric that speaks to both improved patient outcomes and cost savings. Improved adherence can mean fewer emergency room visits and hospitalizations, which translates into lower overall healthcare costs. Incorporating patient feedback and satisfaction surveys as supporting data can further personalize these metrics. For instance, if post-program surveys indicate that 90% of patients felt more informed and confident about their treatment plans, it adds qualitative depth to your quantitative data. Step 4. Balance quantitative and qualitative metrics. While numbers are critical, adding qualitative data can provide context and enhance your case. Suppose your department saw a 30% decrease in patient complaints after a new staff training program you implemented. Pairing this statistic with quotes from patient feedback or positive comments from staff can give a fuller picture. For example, the new process made everything smoother, and I felt like the staff truly cared about my experience. Could be paired with your decreased complaint numbers. This combination demonstrates that your initiative not only improved metrics, but also genuinely impacted people's lives. Identifying key metrics that align with organizational goals and showcasing both operational and patient-centered results will help build a stronger, more compelling case for your salary increase. Remember, the more aligned your data is with what the organization values, the more likely leadership will recognize and reward your contributions. This isn't just about showing that you do your job well. It's about proving that your contributions are critical to the organization's success and future. Let's break down what that looks like. First, you need to highlight any moments where you demonstrated leadership, whether or not they were part of your official job description. Leadership is highly valued by decision makers because it indicates you're capable of taking charge when needed. For example, suppose you led a cross-departmental project to implement a new electronic health record system. This project required coordinating with IT, clinicians, and administrative staff, overcoming resistance to change and ensuring a smooth transition. You could highlight your role like this. Project: implemented a new electronic health record system. Role: project leader coordinating efforts across 5 departments. Outcome, reduced charting time by 20%, leading to more face-to-face patient interaction and better workflow efficiency. These leadership moments demonstrate that you're not just executing tasks, you're influencing outcomes and inspiring change. If you haven't led a major project, don't worry. Smaller leadership moments count too, such as organizing a training workshop or mentoring a new staff member. Step 2. Showcase adaptability and problem solving. Adaptability and problem solving are critical in the community health sector, where unforeseen challenges are the norm. Highlighting times when you adapted quickly and solved significant problems can set you apart. Imagine a situation where your clinic experienced a sudden staff shortage due to an outbreak. If you quickly reorganized resources, adjusted the patient schedule, and communicated effectively with both staff and patients, you're showcasing adaptability. Here's how you might phrase this achievement: challenge staff shortage, affecting patient care due to an unexpected outbreak. Action taken: reorganized workflows, reassigned responsibilities, and implemented a temporary telehealth system for non-urgent visits. Outcome: maintain 90% of appointment capacity and reduce patient wait times by 15% during the crisis. Examples like this show your ability to act decisively under pressure and think on your feet, both of which are essential traits in an administrator. Step 3. Align with future needs. Beyond current contributions, you need to position yourself as someone who's essential for the future of the organization. This involves staying informed about industry trends and demonstrating a commitment to continuous learning and improvement. For instance, if your organization is moving towards more data-driven decision-making, highlight how you completed a course on healthcare analytics or led a pilot program to integrate data insights into daily operations. Here's an example. Initiative: proposed and led a pilot program using data analytics to improve patient follow-up care. Skills demonstrated: used analytics software to identify trends, developed reports, and recommended changes that increased follow-up adherence by 25%. Result: program expanded across all departments, enhancing patient engagement and decreasing follow-up visit no-shows. Highlighting certifications, courses, or even conferences you attended shows that you're not just resting on your laurels, but are investing in your growth. You're sending the message: I'm equipped to contribute to the organization's goals now and in the future. Step 4. Build a case with testimonials and feedback. Finally, don't underestimate the power of testimonials and feedback. Positive comments from supervisors, colleagues, or community partners can reinforce your narrative. Imagine you spearheaded a community health program that received positive feedback from local leaders, including a quote like, "Thanks to Suzanne, our community outreach participation doubled and more families are receiving the care they need," can be compelling evidence. This qualitative feedback can complement your quantitative metrics, painting a fuller picture of why your contributions matter. Positioning yourself as an essential asset means highlighting leadership, showcasing adaptability, aligning your skills with future needs, and using testimonials to strengthen your case. By demonstrating that you're indispensable, you set the stage for a successful salary negotiation. There is a lot of work that goes into leading health teams. Getting a salary that is commensurate with your value is something we all strive for in our work. If you enjoyed this video, please like, subscribe, and share your thoughts in the comments. What salary negotiation are you most proud of in your career? Or is there room for you to grow? I'd love to hear your stories. Joining us next time for part 2 in raising your salary in 6 months. You are making meaningful change.